mitochondrial dysfunction that is actually what is precipitating the genetic changes that we see in metastatic cancer. Since 1977, when the USDA said that cholesterol caused heart disease, we should stop eating meat and fat and start eating more fruits and vegetables and sugar as well. They didn't say we should eat more sugar. They just said it was safe. They said it was an empty calorie and it didn't matter. It very much matters. The cancer rates have tripled. Yeah. So if this was purely genetic, then we would not see that. Anyone who's studied population genetics knows that that's an impossibility.
And welcome to the Ketogenic Diet Show. My name's Mary Beauchamp. I'm a registered nurse, Ketogenic Diet Specialist, and a GAPS Certified Practitioner. GAP stands for Gut and Psychology Syndrome. And today I am very excited to introduce a special guest, Dr. AnthonyChaffee. It is his assertion that most of the so-called chronic diseases treated by doctors are caused by poor nutrition and can be reversed by making dietary changes and adopting a species-appropriate diet.
For people who don't know, I'm an American doctor, but I live in Australia at the moment, and I'm specializing in neurosurgery. I've been a doctor since 2013, but I had to leave my original training program for a family emergency that took a couple of years to take care of, and then I was doing humanitarian work in refugee camps in Bangladesh with the Rohingya refugees that were escaping genocide in Burma and went into Bangladesh. So I was there for a while. And then I came to Australia because I thought Australia was cool and, wanted to see kangaroos and had a rugby background and, was an All-American rugby player and then played professionally in England and in the US. And so I always wanted to come to Australia just for that reason, really, and had opportunities to come down here. So I thought I'd check it out. At the moment, I'm back in neurosurgery, training in that, and really enjoying it. So I've been doing that for now, it's like my third year here doing that. And on to the side of that, I've been, seeing patients in a functional medicine clinic, doing preventative healthcare and weight management here in Perth, Australia as well, on the outside, which is difficult to do because my commitments at the hospital are quite heavy. But I do as best I can. And I've been incorporating, my research and understanding of human nutrition into that. And I have found that people are responding very, very well and having very, very positive results to do with their weight, to do with chronic diseases such as, heart disease, diabetes, and especially autoimmune disorders. Autoimmune disorders just melt away on a carnivore diet once you eliminate the causative factors of the autoimmune issues, which is sort of my focus, not just eating more meat. Obviously, that's very good. That's the basis of our nutrition, but specifically eliminating out things that are going to cause harm to us. And you see a lot of those in the plant and fungi kingdoms. And so trying to eliminate those in order to benefit people's lives and get them as healthy as possible, because some people just have genetic predispositions to getting really horrible illnesses when exposed to these environmental factors that we find in plants. And so just been plugging away with that and doing as many consults as I can and seeing as many people in clinic as I can as time allows with the hospital. People really do need to feel like they are participating in their own recovery. And so they will almost always ask me, what can I do? What can I do to help my situation? And knowing what I know and knowing that diet and nutrition plays such a major role in disease and health, and specifically cancer, I don't think it's ethical for me not to tell them what I know. And so I point them in those directions, and I give them the names of studies and lectures and resources and doctors and researchers who are studying this, and just say, hey, look, here are these guys, here's the information, you take a look at it. There's all peer-reviewed, published data. I mean, there's nothing off the beaten track here. This is real medicine. It's just that not everyone knows about it, and so not everyone is incorporating this into their practice. But a lot of people are, and so I'm just pointing them in those directions. Here are the peer-reviewed articles. Here are the doctors and the researchers doing this sort of work. You take a look at it, see if that's something that you want to incorporate into your life. And so that's how I have to do it there. When I'm in clinic, obviously I can be a bit more forward, like, look, this is what I think is the best way for you to go, and here's why. And I will still give them the same resources so that I always encourage people to look things up and to, and do a bit of digging themselves and not just take my word for it. Anything I say, I want them to then go and check my sources and see if I'm full of it or not, because they need to trust me, but they also need to trust that what they're doing is the right thing. And because it is very, very different than what most people have told them to do their entire lives, obviously it makes people feel a lot better if they have, a lot of evidence saying like, okay, actually, this actually does look like the way to go.
Right. It's so empowering to be able to have and make to encourage your patients to make informed decisions about their body. I think it's really important that they have both sides or all the information before they make a decision. And
Yeah.
people don't often get that in the hospital. Let's face it. There's not a lot of true informed consent going on. So I applaud you
Yeah.
for that.
Yeah. Thanks.
For sure. So if I had cancer, what resources might you recommend?
Well, one of the best resources that I've found is Dr. Thomas Seyfried,
Mhm.
who's out of Boston, and he's been doing just yeoman's work on this for quite some time, and showing. I mean, we've known since the 1930s, from Dr. Otto Warburg, that cancer cells have a high glucose requirement. So those cancer cells take in about 400 times the amount of glucose that our other cells would take in. And so, very simply, someone said like, well, okay, what ketogenic diet, you're limiting the amount of blood sugar that's there. Is this going to limit the amount of energy that the cancer cells get? Is that going to limit their ability to grow? And I found out, yes, that's exactly what happens. And there are also other things that happen as well, biochemically and metabolically. When you take in exogenous carbohydrates, it actually causes a mitochondrial dysfunction. You actually reduce the amount of mitochondria you have, and they actually don't. Their respiration ability actually diminishes, and so they're not as efficient and they're not as effective. And they actually and that inefficiency actually causes different problems. And Dr. Seyfried is actually contending that it's that mitochondrial dysfunction that is actually what is precipitating the genetic changes that we see in metastatic cancer. So, now we have the metabolic theory of cancer as opposed to the genetic theory of cancer. And I think that there's a lot of evidence to suggest that it is more in the metabolic camp than just the genetic camp. One very good point of just population data is that since 1977, when the USDA said that cholesterol caused heart disease, we should stop eating meat and fat and start eating more fruits and vegetables and sugar as well. They didn't say we should eat more sugar. They just said it was safe. They said it was an empty calorie and it didn't matter. It very much matters. The cancer rates have tripled.
Yeah.
So if this was purely genetic, then we would not see that. Anyone who's studied population genetics knows that that's an impossibility without like a mass extinction or some sort of massive event like that. And it's certainly not going to happen in a generation or two. It really just can't. And so something's happening environmentally, and something's affecting us. And now maybe we're just getting exposed to a lot of things that are able to cause genetic damage, maybe, but that tripling effect means that something significant is happening. And people are very conscious about, this has carcinogens. People are not smoking as much, they're not going in the sun as much, they're doing all these sorts of things to reduce their exposure to harmful to harmful effects that could change their genetics. And yet cancer rates have tripled. And so something's happened. And so we do see biochemically that we get cells acting in a more disordered fashion when taking in exogenous carbohydrates. And we have studies looking at a ketogenic diet, and we actually see a more ordered effect at a microcellular level in these cells. And one of these studies actually showed that when people go on a ketogenic diet and their bodies are making the blood sugar that they need, because you're always going to have blood sugar. Your body just now perfectly regulates it. There's no such thing as an essential carbohydrate. That's something that's been a well-established fact for a long time. But when you take in exogenous carbohydrates, this causes problems. So in these studies with the ketogenic diet, they've actually found that your your mitochondrial efficiency increases greatly, and you end up getting about 4 times as many mitochondria. So your bodies are producing more mitochondria, and this is much more efficient. You're making more energy, you're making it more efficiently, and now you have more mitochondria as well, also working more efficiently. So this makes your whole body work a lot better. One of the very interesting things that um, Dr. Seyfried works, and I'm paraphrasing. I'm not going to go through all the complexities of how he sort of showed this, but he showed that when you take, the nucleus out of a cancer cell that has all the genetic markers, that when you then replicate that and take that and put that into a mouse, that doesn't now behave as cancer. You don't get a whole bunch of tumors from that necessarily if you're putting it in with healthy mitochondria. But if you take out the unhealthy mitochondria from the cancer cells and you start introducing these into normal cells with normal DNA, they do start to behave in that fashion. And as we know, I mean, we're sort of taught that cancers are monoclonal, meaning that you have this one cell that went funny and had all the genetic changes, and then all of a sudden that's what grows, and you just have this weird Borg. Then it's just this one thing, one basically line of cells that has the same DNA, but that's actually not what we see. We see some of those cells have that, and a multitude of other cells don't have those genetic changes, but they all actually behave as cancer. They're all part of that tumor body. And so that right there tells you as well, maybe this isn't one-to-one genetics. And, there's a lot of very interesting information. Thomas Seyfried's one of those. There's Dr. Zafria from Paleomedicina from Hungary, and she's been actually just treating people with a carnivore diet or a ketogenic diet if they don't feel that they can do a full carnivore diet for years now, years and years, and with cancer and with other diseases. And she's finding these cancers are just shrinking away. They're just going away with or without chemoradiation. I don't think she's telling people not to go through traditional treatments, but but she's certainly having this as an addition. And I wouldn't recommend people stop doing chemo radiation either. I mean, these are proven efficacies. They have a proven track record. Just with like a GBM, glioblastoma multiforme. This is a very, very aggressive cancer. If you don't do anything, if you don't operate or you don't do chemo radiation, on average, people have a 3-month life expectancy from diagnosis. So that's very, very aggressive cancer. But with surgery and chemoradiation, that goes out to 2 years or more. So we know that these actually do help. But at the same time, there's a single-digit 5-year survival rate. And it's thought to be incurable. Like you will die from this unless you get killed from something before that. Like we can't get rid of it. But over at Paleomedicina, they actually have GBM cases, and she said that's the one cancer that they can't shrink. It won't go away, but it doesn't grow, and that's enough. Like when you're talking about a GBM, because these things grow so aggressively, and if you can actually get this to stop its progression, maybe you catch it early, so you don't need to do surgery, or maybe you do surgery and you debulk this down, so you're not having a lot of problems from that pressure, and then you get on this, and all of a sudden, just whatever little crust is left, it just stays still. Well, you can live with that, I think, and so that's very interesting. And Dr. Seyfried has done work in animal models with glioblastoma multiforme, and shown that a ketogenic diet, as well as limiting glutamine, which is also something that feeds cancers, that this has a very good efficacy in treating rats with GBM. So there's a lot of information there, and so I it's not as maybe as conclusive as we would normally like to then say, okay, this is practice changing guidelines. But I think that for me, I think it's absolutely something that needs to be considered. and something that should be taken very seriously. And the idea that, our nutrition doesn't affect our health that's just an absurdity to me. Like, obviously this is going to help our overall health. And that's one thing I say is, like, whether or not this helps in your struggle with cancer, this will make you healthier. That's a fact. This is all the best evidence shows that humans are carnivores, that this is our biologically appropriate diet. And that is going to confer very serious benefits. And I can tell you all the different things that are going to cause harm, specifically if you eat these other things, because there are toxins in plants. That's how plants defend themselves. Animals can run away or fight back. Plants can't. And so they use poison as one of their main deterrents. They have other things that they do too, but they all use poison. And so when you're limiting that, you're going to limit the amount of harm that these things can do, and you're going to be healthier. And whether or not that translates into a better cancer prognosis remains to be seen, but it will help you. It will make you healthier. It will help your struggle and recovery. It just will. And so that's what I recommend to people, just to at least look into anyway.
Great. I love those references. I reference both of those people in my book as well.
They're great.
I didn't really say anything about my book, but I have a book coming out. It's called Radical Health Makeover, The Science and Spirituality of Self-Healing. And I very much talk about the resources that you gave as well. So I appreciate you validating that for me.
Great. Yeah.
I mentioned them on my website as well. And, I'm a big fan of giving resources. So I list a lot of people's work in my book, so that they can go and have the tools they need to really find out what's best for them. And like you said, the more tools you can have and the more knowledge you have, the more empowered you're going to be to make these decisions about your body. And if your whole body is on board, your psyche, your mind, that's going to make a huge impact as well on how well you can recover. And if you believe in what you're doing, that is a huge step in the right direction. You really have to believe that you're doing the right thing for yourself, because that's the way the body was designed, and the placebo effect is real. So it's super important that people take responsibility for that, and it's a big part of particularly cancer. But other things as well. So what I've been doing is just, I help people get keto adapted, period. And I've noticed over the many years of doing this that a lot of people come to me, a lot of medical people actually, and say, I've tried everything. It's not working. I don't know what I'm doing wrong. So I sort of help people troubleshoot that and just make sure that they're getting keto adapted. And so there's a pretty specific formula for that. One of them is, obviously cutting out all plants. And so cancer is sort of one topic over here, but the other topic is, getting metabolically healthy and flexible so that your immune system is strengthened and you're more resilient. But the other part of this is what you mentioned earlier was people with autoimmune issues and autoimmune disorders and diseases, where keto is great, but there's a lot of ways that you can do it that isn't so great. And so that's kind of what I've been focusing on in the last probably 5 years pretty heavily, and have come to the place of really being able to target gut health. And in doing so, that requires people to just simply eliminate plants. And this is not a new concept. Our ancestors have been doing this for millions of years. And, Dr. Natasha Campbell, McBride, she's the founder of GAPS, Gut and Psychology Syndrome. She wrote a book called Gut and Psychology Syndrome. She's been, helping children reverse autism by healing their gut, doing this for, 40 years. So this is not anything new, but like you said, we are now hearing more about this carnivore diet, and really all that this is eliminating plants from the diet. And because, like you said, plants carry toxic materials that are harmful to the digestive tract, they inflame the gut. And when that happens, you are basically releasing toxic particles into your bloodstream through the leaky gut wall. And that's when we see all of these problems happen. And so maybe you could just illuminate a little bit more about how you came upon the carnivore diet. I know you've been doing this for a while, and you're an athlete and have a lot of history with athletic performance. And so it's interesting for me to hear your take on what got you into carnivore and what you might tell somebody with an autoimmune condition.
Yeah, I just say also just I completely agree with all of that as well, and especially with cancer, talking about really believing in your treatment. I think that's very important. I was talking, early on in my medical education, I was speaking to I was on an oncology rotation, and the oncologist there said that it's very important to get people on board with what you're doing. And what he would tell people, he said, okay, this is what I propose, this is what I think is the best. You don't need to listen to me. You can get a second opinion, but do research, look at these things, and whatever you get on, just get on something that you believe will work. Because that's so important. If you don't believe this is going to work, it's not going to work.
That's right.
And so just get on something, whether it's with me or someone else. Just get it involved in something that you believe in. So yeah, that's a very, very important thing as well. It'd be great to know the mechanisms of that. Yeah. Yeah, so it's really important to be on board with your treatment mentally, because that makes a massive difference. It'd be nice to know what the mechanism of that is, but
Uh-huh.
we don't necessarily aren't necessarily going to be able to figure that out. But it is something. There is something going on, and there are studies with showing placebo with even morphine, and giving half the people who have major abdominal surgery morphine, the other half saline, and they found that the people getting saline actually have 40% of them have the same response as the morphine group. And then, more interestingly, they gave naloxone, which is an antagonist for opiates, and should block this off. And so those people that actually were given saline, naloxone actually blocked their effect. And they went, oh, what's going on? I'm in pain now. And so, very interesting. So their body was naturally hitting and using those opioid receptors that we have naturally, because obviously they're natural. Our body uses those on its own, and it's just the plant then kicks off onto those receptors. Seemingly by accident, but they do. So there is something to that, and so yeah, I agree with that. Yeah, so my background getting into a carnivore diet is also why I focus on the what not to eat side of thing, because when I was taking cancer biology, my undergraduate degree, I don't know, 22 years ago, we learned day one that this is how plants defend themselves, is by using different poisons. And that's actually something that you learn in introductory biology. In like 7th or 8th grade, you'll learn this, that plants and animals are in an evolutionary arms race. Plants becoming more and more poisonous, so less and less animals can eat them, so they can survive and thrive. And then animals becoming more and more adapted to specific poisons in specific plants, so they can break those down safely and harmlessly, and they can eat that plant and survive and thrive. And this is like with koalas, they're the only things that eat eucalyptus, right? But they don't eat anything else. And so they're specifically adapted to the eucalyptus tree, and they can eat these things safely. Other things cannot. Eucalyptus will seriously damage anybody who tries to eat that thing. And so they have a dedicated food source. They don't have to compete for resources, which is why koalas are pretty chilled animals. They're not really in a struggle for survival, because they don't really have to compete that hard. In cancer biology, we were looking at this from a cancer perspective. What causes cancer? Cancer is probably a metabolic process, but there's certainly these genetic markers in there as well. But something's going on that you're having, if something is a carcinogen, it's causing a disruption of your normal cellular function, and eventually can precipitate into full-blown metastatic disease. So whether or not you get cancer, this is causing harm the whole time, right? So looking at things as a carcinogen, it's not only a concern because eventually you might develop cancer. It's a concern because it's damaging your body every time you consume it or are exposed to it. So it's a major thing. So we were looking at carcinogens in plants, and 22 years ago, we had already discovered 136 separate known human carcinogens in Brussels sprouts, just Brussels sprouts, and white table mushrooms, over 100. And we're given literally sheets of paper. We're just like spinach, kale, lettuce, celery, cabbage, cucumber, broccoli. I mean, you name it. Like any plant that you've ever eaten in your life, it was on this, and they had 60, 80, or over 100 known human carcinogens each. We know that they're abundant. We know that from Dr. Bruce Ames from Berkeley in 1989, he published a large paper looking at poisons in plants because they were trying to get rid of pesticides. And he was saying, we've been using pesticides for like 80 years. They've never caused a problem. Why is that causing a problem now? And so he looked into it. And he found that the naturally occurring poisons were actually far more abundant than the pesticides we were spraying on them by a factor of 10,000. So there's 10,000 times more naturally occurring insecticides and pesticides that the plant makes to stop pests and insects from eating them than the pesticides we were spraying on them commercially. And we were using a lot more back then because we didn't have the computer models to like sort of carefully spray just the needed amount. We were using helicopters to crop dust entire fields and be hosing things down. So we were using this stuff in a lot, much larger abundance. And again, it was only 1/10,000th of the amount that was actually naturally occurring in these plants and fungi and mushrooms. And that the naturally occurring poisons were actually far more likely to cause cancer than the pesticides we sprayed on them by orders of magnitude. And so that is why we still have pesticides. They were actually trying to ban pesticides, and he sort of came out like, well, let's look at this. And okay, and the spinach was worse than the pesticides we sprayed on the spinach. So people went, okay, yeah, all right, it's a drop in the bucket. So this was very, very shocking to us when we were learning this. Obviously, you're taught your whole life that vegetables are good for you, at least since the late 70s and early 80s. That this is just the most important things for you to eat. They're the healthiest things for you to eat. And now we're learning that these things are just absolute, toxic, chemical factories, which they are. And I remember like thrashing around, looking around like, oh, this has to be a joke. Everyone was looking around. Everyone was like, this has to be a joke. Like, who's laughing? Who's in on this? And we were just looking for one TA just to be like, yeah, he's just messing with you, but no one was. Everyone was just as bewildered as we were. And it ended up sort of dawning on us and sinking in that this guy was serious. And I remember thinking, I was like, well, but vegetables are still good for you though, right? Like, even though they have all this stuff. And he just looked at us and he just said, I don't eat salad. I don't eat vegetables. I don't let my kids eat vegetables. Plants are trying to kill you. So I was like, right, screw plants. Like, just don't need to touch those things. And I went to the store and I just started just looking for things that did not contain plants. Everything contained plants. Plants are in everything. Plants, sugar, grains, they're in everything. And so I was just walking around like, what the hell can I even eat that doesn't have a plant in it? And I found some eggs. I was like, okay, eggs aren't from plants. And like meat doesn't come from plants. Like milk doesn't come from plants. So I just ate eggs, meat, and milk. And I wasn't thinking of it as a carnivore diet. I don't think that was really something people were talking about back in 2000, but that was what it was. And I was just not eating plants. I just didn't want to eat plants. And you learn in school that humans are apex predators. They call them hunter gatherers, but we were really just hunters and apex predators. Apex predators don't graze. I've never seen a shark eat kelp for roughage, And so, animals that are at the top of the food chain, they are eating the animals below it on the food chain. And it's the bottom level of the food chain that are eating the plants to then filter out the poisons so that the other animals can eat them safely, because they can't eat the plants safely. And so I was just doing this for a number of years. And I was, playing, high level rugby. I was playing professionally and I was playing with my university team and my men's team. We're playing in the Canadian Premiership. We're playing in the American Super League, and doing all-star sort of things. So I represented West Coast in different all-star tournaments. Was being looked at for the 2003 World Cup and then 2007 World Cup, and so I was just heavily involved in athletics, and I was not getting tired. I wasn't getting sore. I wasn't able to run out of since I was able to push myself so much harder than other people were. My performance was getting much better, and my results and just my acceleration into fitness was just going so much faster because I was pushing myself much harder, and also I was getting a lot more out of it. And then I could push myself harder and harder and harder. So like, I had exponential growth and everyone else was linear. And so I got to a point where I was just so much better shape than everyone else. Like, I literally just couldn't get tired from a full rugby game, which is, if anyone's played rugby, it's a very, energy dependent game. And, and I was playing in a very aggressive, violent manner, and I was, putting a lot of energy and explosiveness into it. I played open side flanker. People know what that means. I was doing a lot of running. I was doing a lot of work, a lot of sprinting, a lot of tackling, a lot of running the ball, a lot of hitting rucks, and just your job as an open side flanker is just to be all over the pitch at all times. And just really just getting involved in just everything you can, just being an absolute nuisance and menace to the other team. And so, I was able to do that. And at the end of the game, like I wouldn't even be tired. I would be like antsy. I have like so much energy. I'm like, that wasn't even a workout. Like I got to go work out. Like I got to go do something. Like how am I going to have time before like the team dinner? And it was like, I need to go run and to go do sprints. Like, what can I do? And whereas everyone else was pretty shattered, I would be, just feeling better and better and better as I went. So that was a huge advantage for me. And I didn't even realize it at the time, but I stopped drinking at the same time during the rugby season. And I sort of equated it with that, which obviously makes a huge difference, but alcohol comes from a plant. So it's just, part and parcel of the same phenomena. And, I just felt absolutely incredible. And, years later, when I was in England, I couldn't really get access to the same, quality of meat or a lot of these things were breaded, and just had some difficulty. So I was getting some things that were breaded, and I was like, oh, does that really make a big difference? It's just a little bit. It made a big difference. A few months into it, all of a sudden I'm much more sore. I'm, sort of not feeling my best. I remember thinking to myself, like, why don't I feel as just unbelievably amazing as I normally do? Am I just not working out as hard? I'm not, pushing myself. And I just turned 25. So I'm like, is that it? Is that over the hump? And am I just dying from here? 25, like that's the lip. But looking back on it, that's when I like just slowly started reintroducing plants into my diet because of that breading on the meat. And then, at some point I just wasn't thinking about it. And so, I just started a little bit here and a little bit here and a little bit there. And then I was sort of more eating a more, standard Western diet, but still very meat heavy, and very little carbs and vegetables. But then people started pushing in the whole plant thing. Oh, you got to have plants, you got to have vegetables, you got to have mushrooms. Like Dr. Furman came out with the Gomes diet, and my brother's really into that. It's like, oh, you got to read this. He's talking about all these different ways that these things are beneficial. And I was like, well, but they have a lot of things that are not beneficial too. So, I mean, that's cherry picking, like you're talking about the good things, you're not talking about the bad things. And I was like, that didn't really make sense to me. But, I ended up sort of slipping off and just sort of getting this impressed upon me, because I didn't realize how, what I was doing was so significant, and that humans really are carnivores, and that's what we are. And that's why I was feeling so good, because I was eating in a natural way, until, I don't know, five years ago or so. Just came across, Dr. Sean Baker on Joe Rogan. My brother actually put me onto him as well, and said, hey, there's this guy, he's a doctor. He also played, rugby professionally down in New Zealand. And he's talking about how you can get all your nutrients just from eating meat. And obviously instantly that just threw up some, flags in my head, and like, oh, that kind of goes against everything that you're taught. But at the same time, I remember thinking, I was like, well, that's actually not too far fetched, because I was doing that for years, really, because I wasn't eating any plants. And I remember thinking at the time, like every few months, I would think to myself, I was like, do I need to eat a banana or something? Do I need vitamins? Like, should I take like a multivitamin? But I remember thinking to myself, I was like, well, I feel good. My gums aren't bleeding. So I'll just, keep going and see how it goes. I never had a problem. And I've never felt better in my entire life. And I remember thinking about that at the time, saying like, well, actually I felt better than I've ever felt in my life, and I only ate meat. And so it's actually not too far fetched. And, technically, I guess, humans are apex predators. So that should make sense. We should be able to do that. And so I said, all right, I'll watch the interview and let you know what I think. Within 5 minutes of watching this, I was like, this guy's really onto something. And I watched the rest of it. I was like, this guy's more right than he knows, really, because like I had been studying, Dr. Robert Lustig's work on fructose, and showing that this was actually probably the driver for diabetes and heart disease rather than cholesterol, and the cholesterol saturated fat issue being really turned on its head, especially in 2015, when the Journal of American Medical Association published actual internal memos from the sugar companies talking about how they paid off Harvard professors and other professors around the country to falsify data and publish fraudulent studies to make it appear as if cholesterol caused heart disease when it was really sugar. And one of these Harvard professors was named head of the USDA. And it was he who authored and pushed forward the 1977 USDA declaration that cholesterol caused heart disease. And so we have hard evidence of this now. We have hard evidence that that was not only wrong, not only false, but fraudulent. And you look at their actual work actually showed no correlation between cholesterol and heart disease. And now, these sorts of correlative studies, correlation does not prove causation, just like there's a correlation between increased ice cream sales and increased shark attacks. It's not that people are more sweet and the shark likes to eat sweet people. It's more that ice cream sales go up in the summer when it's hotter and more people are in the water and being exposed to sharks, right? So there's a correlation, but that doesn't mean that there's a causation. However, if you show that there is no correlation, that proves there is no causation, because you cannot have causation without correlation first. And so their own study showed no correlation between increased cholesterol and heart disease. So there is no causation. And I knew that. And I knew a few other things. And I knew about, 20 years earlier, 15 years earlier at that time, that, plants are trying to kill us and that they actually have poison. And I remember looking at it, I was like, right, I knew it. I knew plants were trying to kill me. I get rid of these filthy things. And I just cut them out. And, my health improved dramatically after that. I mean, just in countless ways. And then I really started digging into the research and the literature just to say, okay, what do we know? What can we prove? And I just really, really just spent months and months and months and months and months and continued on since then, constantly looking at things. But for that initial thing, like, I was at that time I was taking off time from work. And so I really had time to just really just dig into the literature for, 6-8 hours a day, every day for months. Like, I really went after this, found out a lot of really cool things. And so, that was my sort of birth and development into a carnivore lifestyle. Since then, now incorporating this into my practice, I see absolutely fantastic results. A theory is only as good as what it's able to predict, and what we are able to predict is coming true. Saying that if you do this, this will happen. If you eliminate plants and sugar and eat fatty meat and water exclusively, your Hashimoto's will go away. Your antibodies will go down. Your requirement for medications will reduce and be eliminated eventually. We see that in practice. If you're a type 2 diabetic, if you do this, your blood sugars will normalize. You'll still have peripheral insulin resistance for a while, but over the course of the next month or two, that will reverse as well, and you'll be able to come off basically all of your medications. And even if you're an insulin dependent type 2 diabetic, most of the time people can come off their insulin as well. And you just say, like, if you do this, this will happen. It happens every time.
Right.
And so that has very, very good predictive force. And so that's exactly what I'm seeing with autoimmune. Every autoimmune, I have not seen an autoimmune issue that this does not help. Graves' disease, Hashimoto's, certainly Crohn's, ulcerative colitis. We have data going back to the 1800s for Crohn's, ulcerative colitis, and rheumatoid arthritis being cured with a pure red meat and water diet, going back to Dr. J.H. Salisbury, but all the way up to 1975, a book called The Stone Age Diet by Dr. Volklin, spelled really weird. And he was a gastroenterologist, and he was talking like, hey, we're carnivores. That's the kind of animal we are. Here's the evidence for it. And, and basically arguing that, you could get rid of all of these diseases, especially the gastrointestinal issues and IBD, IBS, SIBO. These things go away. They just go away when you go on a pure red meat and water diet. And then 1977 happened, and they just went, right, throw it all out, because obviously, meat's horrible for you because it has cholesterol. And that was it. And everyone just forgot the last 100 years of peer-reviewed data. Yeah. It just went out the window. And what happened? The obesity rate tripled, heart disease rate tripled, stroke rate tripled, cancer rates tripled, type 2 diabetes, autoimmune disorders, Alzheimer's, Parkinson's, even neurodevelopmental delays such as autism. These things increased exponentially. They almost didn't exist before then. Now they're the only things we treat. And it really is. I mean, there's the chronic disease, model is like, that's it. That's all we treat now. It used to be accidents and injuries, pregnancy and childbirth, infectious disease, and and like genetic disorders, like congenital or genetic disorders, and then poisonings. Right now, chronic disease takes up all of that. But what I argue is that chronic disease is actually that fifth one, poisoning, and we are poisoning ourselves without realizing it, and we are getting poisoned. So I don't think of type 2 diabetes as a disease. I consider that carbohydrate and sugar poisoning. And autoimmune disorders, to the genetically susceptible, being poisoned by these various things. We don't know all the different triggers that will set this off, but we do know that if you eliminate plants, that gets rid of them. They
Yeah.
exist in there somewhere. And so that is a dose response relationship. When you expose somebody to this, they get this response, and then when you take it away, it goes away. So that is not a disease. That is an exposure response. That's not a disease response. Well, if you go back, I think it's interesting. I don't know, other people don't, but I like looking at the early explorer records, and a lot of these people wrote books, and they're in their journeys and around the world, which was pretty fascinating time, to do that. It's very, very dangerous. And you're just going, it takes 9 months to get, to another continent. And then you're there, and there's, it's a very different place, and you have to survive, and you have to, just figure out a lot of, things in a very unfamiliar environment. It's very, very cool. There's always going to be something on the native peoples that they encounter and their interactions with them. And so I've seen this with people coming to New England, North America, in the late 1400s, 1500s, and then in Australia in the 1600s. And you read these things, there will always be a chapter on diet every time.
Yeah.
And I sort of started looking at that when I was thinking this way. I started looking at these different, every time I come across them, I just look and see if there's a chapter on it. Every time there's a chapter on diet, because they are marveling that these guys, they only eat meat.
Yep.
And it's not because they have to, it's because they only want to. And they're offered, they have bread, they have this, they offer them that. They're like, get that away from me. And some people would actually have their preferred meat that they would want. So like in Tasmania, they only ate mollusks. They would go diving for abalone and things like that. And, this was the book that I was reading by a Belgian explorer. He says, like, yeah, that's the only thing I want to eat. We caught like fish, like just normal fish, and we offered them to that. And they're like, yeah, get that away. We don't want that crap. They only wanted the abalone. That was it. And so some areas were, a little more harsh, especially when you go towards the interior of Australia. It's very harsh. And so some places wouldn't necessarily have the resources to eat 100% meat all year round. And so they knew which plants that they could eat and to survive or to use medicinally. But all of the accounts were similar, where they would talk about, like, if they needed to, they knew which plants to eat. But if they had meat, they would not eat the plants at all. And so a lot of anthropologists, or people just trying to, going for confirmation bias to say, oh, well, actually they were very plant heavy. They talk about the different plants that they eat, and they ate this plant and this plant, and they made a tea out of this, and they did this, and they did this. But they don't tell you the frequency that they use these things. They don't tell you that they only used that once in a blue moon when they couldn't get kangaroo. And they didn't tell you that all the other tribes that could get kangaroo or mollusks or whatever they were eating year round never touched the stuff. And say, they made this tea. Yeah, they made that tea when they had this illness to drink and then help with that illness, and never again. So, that those details matter. The devil's in the details. And so the native Australians, all the accounts, from different missionaries that lived with these guys for hundreds of years, they were just like, yeah, these guys, we tried to give them bread. They just didn't touch it. They didn't want it. All the accounts are very similar. In North America, I remember I was reading one, this guy was just blown away that everyone was just eating meat. And obviously, with the Plains Indians, they were just eating, buffalo all year round, and they would make pemmican, and they would, drive a herd off the cliff, and they would, eat the fresh meat while it was fresh, and then they would dry the rest of it, and that's what they would eat throughout the rest of the year. Just an interesting aside: people say that you had to have agriculture and cultivation of crops in order to have any sort of large civilization. That's not true. There were 100 million Native Americans in North America before the Europeans came here. They were purely carnivorous. There was a city where St. Louis is now, with permanent buildings and longhouses that could have housed 1 million full-time residents.
Wow.
So that's wrong. And these people only ate meat, but they were able to get meat and preserve it. And that's the main thing, is that preservation of food and being able to store it for long periods of time and be able to take it from somewhere distant and bring it over here. So that if someone's living in this city, they have food coming to them. That's really the benefit of agriculture, is that you can do that, but you can do that with meat as well, as the Native Americans did.
Right.
So, yeah. And so up north, obviously, Canada is very, very cold, and it was actually colder then. Sort of in the 1800s, the temperature rose about a degree Celsius, and that actually made the first 100 miles of Canada, of what is now Canada, more hospitable. Before that, it was just like a bunch of French fur trappers, just living in very harsh environments, and then obviously the natives. So one of these early settlers in that area was talking about the natives and how they only ate meat. And he said that, I understand it during the winter months, 9 months out of the year, it's just packed with snow and there's really no getting around it. You're not going to grow crops in that. And so you'd have to eat meat. I get that. But 3 months out of the year, it does thaw, and you could plant crops. And so, I always love how he phrased it. He's like, so surely they could live off the bounty of the land, but they don't. They only ate meat. So even in the months that they had access to plants, they didn't eat them. They could eat. I'm sure they knew what they could eat if they were starving.
Right.
But that's a very different thing than eating them preferentially.
Yeah. Did you ever read the Lewis and Clark expeditions through North America?
I didn't read all of them, but we went through some of them as a school kid. But no, it's actually something I should definitely look into. That's a very famous expedition.
It's pretty fascinating. I've read some of the journeys that in their journals. They kept journals, and they were really documenting all the plant life, and the things they were discovering. And one of the things that they all realized just by being in North America for a short time was they had to eat the fattiest meat or they would die. And so they would feed the lean meat to their dogs from the elk that they would hunt. And then they followed the river that they called it the Yukon Trail, because they only would eat the Yukon fish, which were the fattiest fish they could find. And that's how they survived. I mean, it was brutal conditions, but there was very short snippets of what they were eating, and they had written that in their journals. It's fascinating, but it was all about the fattiest meat. And if they didn't get the fatty meat, they died, so they learned really quick that they couldn't survive on just the lean muscle meat of the animals. So anyway, that's why we're here. We evolved eating this way, and we wouldn't be here right now if our ancestors didn't do that. And somehow we forgot that along the way. And we're so easily, I don't want to say brainwashed, but sort of swayed in directions based on what we hear in the media. And now that, you've looked at the research, I've looked at a lot of the research, and it's like, wait, this is just not right. Like what we're being told and what we're being taught, even in medical schools and universities, is not actually factual. And that's a little bit concerning, for us to try to swing the pendulum the other way. It's difficult. And so, yeah, I mean, it's kind of mind-boggling to me that we've gotten so far off track as a human species. And so maybe in that regard, you could speak a little bit to what you might consider. We've talked about carnivore, but what does that actually mean? Like, what is a species appropriate diet from your perspective?
Yeah. Well, I mean, that's the thing, different species of animal, and we are a species of animal, have different optimal diets. I mean, they just do, whether you base that on evolution or creationism, we are all designed to eat a certain way. and a very specific way. And if you look at animals in the wild, they have specific dietary requirements, and they eat very specific things. So even animals that exclusively eat plants, they eat very specific plants,
Yeah.
and they don't eat a wide variety of them. We're told you have to eat a wide variety of plants. You want to get all these different nutrients from all these different plants. Well, that is not something that's replicated anywhere in nature, including when you look at humans. Because when we look at native populations who never got the chronic diseases that we're seeing today, they did not do that. They had very monotonous diets. They ate a carnivore diet, and that was actually another thing that this was remarked on for hundreds of years, that these native populations that only eat meat, they don't get the so-called diseases of the West. And the diseases of the West were things like obesity and gout and other chronic problems that came from eating the wrong things, and these guys weren't getting them. That's interesting. Only Westerners get this. That's interesting. Now we just call that life. We call that getting older.
Right.
And and the Native Australians, they're hit much harder by this. The Native Americans are hit much harder by this because they were carnivores right up until a couple hundred years ago, and or even 100 years ago, a lot of these people. So they don't have any of the genetic adaptations to protect them properly, and so they're closer to our past, our roots, as it were. Different populations have had exposure to agriculture and have built up certain defenses against them, but it's not immunities, and these things aren't optimal, certainly. But I remember learning as a kid that when Native Americans ate a Western diet, they were 4 times as likely to get all the major chronic diseases: obesity, heart disease, diabetes, cancer. And I remember thinking at the time, I was like, well, doesn't that mean that the food is causing the disease? Because if they don't eat the food, they don't get the disease. And we eat the food and we get the disease, we just get it at a lower rate. And what is a non-Western diet? What are they eating that we're not? What's the difference there? They don't tell you at the time, but what it was is a high-fat carnivore diet. But again, high fat. Here in Australia, when the native Aboriginals would eat a Western diet, they get very, very sick, and they get much more sick than any other population. In fact, in the hospitals, one of the first things I learned here was that when you're treating an Aboriginal patient, whatever their age is on their sticker, add 20 to that, because that's their bodies just break down quicker and more quickly. And so when you're thinking about, okay, what are the risk factors for someone who's 65, they're going to be a little different than someone who's 30 or 40, and okay, it's more commonly going to be this or that, and you work on your differentials when you're going for a diagnosis. In the native population, you just add 20 to that because their bodies are breaking down so much faster. But that's only when they're eating a Western diet.
So you're seeing those chronic diseases happen much earlier in the age span?
Yeah, absolutely. Yeah. Cancer's much earlier, diabetes much earlier, heart disease, autoimmune disorder way earlier, way earlier. And, I've spoken to a lot of these guys in the hospital setting, and, just sort of came on the subject of meat and diets. I was like, well, this is what I looked at, and, talked about, their native diets. And they're like, yeah, you know what? When I was a kid, we never ate anything except meat. We only ate meat. And we were all skinny and healthy and strong. And, we didn't go to the dentist. We never had, tooth decay. We didn't have any problems like this. And he's like, and I remember one guy was thinking, he's like, yeah, that's right. And he's like, yeah, I'm going to talk to my nephew and get some, kangaroo tails and just start going on that. And he said, we were talking about meat, and he said, and he pointed at me, he said, and what the most important part is the fat. I was like, you're damn right it is. And so that was the thing. It goes back to the fat. The fat is a very, very important part of this.
Yeah.
So
what do you eat in a day?
Well, so just meat. I'm very strict, just meat, salt, water.
Okay.
And and so, mostly beef is what I eat. And so I'll age and prepare and get my steaks to the point that I'm making like, I don't think I've been to a steakhouse that makes a steak better than I do, just like on a Tuesday, so because this is all I do. And, the way to cook, the best way to get a good result out of a steak is really the preparation before time. I wet age these things in a cryovac pack for a month before I open them up. Then I open them up and I cut them into steaks, salt all surfaces, put them on drying racks, for several days or even over a week or so. And that the salt soaks into that, dries out a bit, it browns a lot better, it cooks a lot better. That was actually one of the problems I had cooking meat in England. Was it just had it was wetter. I don't know what it was, but I tried to cook these things, they wouldn't brown. Like the steaks wouldn't brown, and so I'd just be like waiting, and it wouldn't go. I turned it over, it was just sort of gray on the side. I couldn't get it to brown. I was just waiting for it to brown, waiting for it to brown. It wouldn't brown. I turned it over, it's not brown, and it was just sort of gray. But then I would cook it well done, and so I really wasn't enjoying it because I couldn't get it to cook right. And that was part of the problem. Is I started buying pre-cooked meat, and half of the time it was breaded, and so that was my descent into breaking away. But now I when I do that, it dries out a little bit, but yeah, brown's so much better, taste is so much better, and it just concentrates just the beefiness much more. And so that's really all I eat is just beef and water, really. Sometimes I'll have chicken, sometimes I'll have fish or lamb or pork, but 99% of the time, I'm just eating beef. And most of the time that is ribeye. Like the price of ribeye for some reason has doubled in the last year. So I'm sort of maybe going away from that. So I started, last time I went to Costco, I got a whole bunch of like New York strip steaks. So, and that was literally half the price. So, I'm not, I like ribeye, but I'm not going to be a sucker at the same time.
Right.
Yeah. And,
so ribeye, that's a fattier cut of meat. So
yeah.
you don't add any fat to that? No tallow or anything like that? You're just eating steak?
I will often actually add like melt butter into it.
Okay. Yeah.
Especially because here in Australia, they really took it to heart that fat was bad for you. And so that's really just what the markets support here. They really want lean cuts. And so they've actually bred the cattle here to be more lean. So they've sort of ruined the stock, and so everything's much more lean than it would be in America. And then they trim these things to distraction. I mean, it's just too much. And so so the ribeyes you get here are not like a ribeye what you would get in America. They actually call it a Scotch fillet, and that's probably more accurate. It's not a ribeye. Yeah, it's and all the fat's trimmed off of it. It's just completely trimmed off it, and so it's much more lean, and it's a bit annoying. But so then I would add in some butter or tallow just to up that up. But like in America, you wouldn't necessarily have to do that if you get a fatty ribeye, like even just choice. I mean, you get a prime one, like it's probably too much. It's like quite a lot. Like a prime ribeye would be serious fat content. Yeah. But so I would add a bit of fat into that because I do like to keep my fat intake between like 70 and 80% of my calories from fat. And like a normal ribeye, like in America, would be like 70% calories from fat. Here would be maybe about the same, maybe a bit less, depending on the one you got. So I would add a bit of butter onto that just to beef it up. But that's really what I eat. My hard rule again is it's more about what not to eat. And so my hard rule is no plants, no sugar, nothing artificial. And some people say that, oh, that's too restrictive, you're going to scare people off, or they won't be able to maintain that. I think it's quite the opposite. I think that when you have very clear distinctions in what you can and can't eat, it makes things so much easier. You know exactly what you can eat, you know exactly what you can't eat. There's no middle ground. No plants, no sugar, nothing artificial. That goes for sauces, seasonings, and drinks as well. Well, what about pepper? Oh, that's a plant. Well, what about coffee? Oh, that's a plant. Well, what about honey? Oh, that's sugar. Well, what about stevia? Oh, that's it could be a plant or artificial. What about sorbitol? Oh, that's artificial. So it's very easy. You can just test these things against that. You know exactly what you can eat. You know exactly what you can't eat. And I think that makes it a lot easier for people when they're, instead of blurring those lines and just sort of eating a bit of this and a bit of that, because it's very easy when you're eating some of the wrong things to say, well, that's not that big of a deal. So maybe a little bit more is not that big of a deal. And maybe a little bit of this stuff is not that big of a deal. And then you're just back to where you were. And I think that's, from what I've seen from people that I've helped in my practice, that's usually when they have a problem, is when they're not doing it quite full on, maybe the first 2 weeks are a bit rough because they're like me, just looking at all the things that they can't eat when I first did this. But after 2 weeks, you really stop caring. You just don't even want to eat any of that stuff because you feel so good. You really enjoy what you eat, and you don't even look at that stuff as food anymore. You don't even consider it food anymore. It's really not. Going back to what you're talking about, like, what is human nutrition? You know, nutrition and diet is species specific. And so bread is not food for a human. The food of a dolphin is not the food for a giraffe, but the food for a giraffe is not the food for a gorilla or a cottontail rabbit or a deer or all these things. They have different diets because they are different species. It's species specific. And all the best data shows that humans are carnivores. If we were not carnivores, if we couldn't thrive as carnivores, or at least survive as carnivores, we would not be here because we made it through the ice ages. The ice ages did not have edible plants available. They did not have fruit and honey available. They did not have any of these things available. We had to get everything that we needed from meat. The Inuits by the North Pole, there are no plants to eat. They have to get everything they need from meat. And so we know this. We have hard evidence. That's as hard of evidence as you're going to get. Actual real life. Can you do it? Did you do it? Yes, you did. There it is. That's like, people say, well, where's your randomized control trial? Okay, where's your randomized control trial showing the parachutes work? Okay, so are you going to go parachuting? You're going to go jump out of the plane without a parachute because there's no randomized control trial to show it? There's no study at all, actually, that shows it. So, are you going to be that guy and just jump out? And, well, actually, there's no scientific evidence to show. So this is just garbage. And so I'm just going to jump out without it. No, you're going to take the damn parachute, right? Because you're not an idiot and you can see that it works, and you can see the alternative as well. So, there is evidence that exists outside of a randomized controlled trial. And, what Richard Feynman, the physicist, said, he said that, it doesn't matter how brilliant your theory is, and it doesn't matter how smart you are. If it doesn't agree with experiment, it's wrong. And so when you have a group of people living in the North Pole that don't have access to plants and they're surviving generationally, your theory that you have to have plants to survive is wrong because we can see that you don't, and then we had people coming through all the ice ages as well, which lasted tens of thousands of years. And there were many of them for the last 2.5, 3 million years. So that's not going to happen. It just can't happen. So we know that. And so our species specific diet is a carnivore diet. And as any animal in the wild, if you eat outside of your species specific diet, you're going to get problems. So any zookeeper can tell you, if you feed an animal something that it doesn't eat in the wild, something it didn't evolve on, it gets sick. But what does it get sick with? It gets obesity, heart disease, diabetes, cancer, liver disease, and autoimmune disorders or even arthritis. Dogs and cats, known carnivores, and yet we give them grain and plant-based kibble. They also get these same diseases. We get the same diseases because they're not diseases, they're toxicities. These are poisons, toxic buildup of species inappropriate diet, and the lack of species specific nutrition. So we're getting malnourished and poisoned, from too many plants, not enough meat for us, and they're not, getting what they need. People say it's like, well, animals are, and I was think as well, when I was a kid, I was like, why are so many people not in, you see animals in the wild, they're ripped, they're just so muscular, so strong. And yet humans are just squishy, and yet we took over the entire globe. We are absolutely in charge of this planet. Don't tell the ants. I think they probably have their part of the world very much in control, but the rest of it, we are very much in charge of. How did we get that? How to become the most dominant species if we were just, the only squishy animals on Earth? Well, our brain, and that's good. But, at the same time, and that's what I was thinking. I was like, oh, well, maybe we can be squishy but smart, but it's still sort of, it was a bit weird. But all these animals are so muscular and so powerful. And the pat answer to that was, well, they're in the wild, they're running around, they're getting a lot of exercise, because that's, probably even still today, most people think that the only way to get in shape or be physically fit is if you exercise a great deal, which I'm living proof that you don't need to do that, because I don't have time to work out. And like, I still look like I work out, more than everyone else, and I work out way less than everyone else.
Mhm.
And, so, but, that doesn't make sense either, because, you know, that doesn't explain animals in the zoo. Animals in the zoo aren't fat and out of shape. Have you ever seen a fat zebra? Fat lion, fat giraffe? I haven't,
No,
and if
but
they're being,
the carnivorous animals in the animal kingdom are much smarter than the herbivores, right? So
yeah,
we
well, they'd
we
have to be.
we
Yeah.
we
Yeah.
benefited from that along the way, and got smart and learned how to hunt and use tools,
Yeah.
and
Yeah.
that's
Well, yeah. Yeah. Well, yeah, and that's the thing. You do have to be, have a modicum of intelligence to hunt and get your food. It doesn't take much intelligence to hunt a lettuce,
right.
or hunt grass, you know,
Exactly.
and you don't have to sneak up on it even,
Exactly.
and that's the thing too, is, because we were eating meat, and that, we had to start figuring out, okay, how are we going to get this? And so at first we're sort of scavengers, sort of eating what other animals, left, using rocks to break open the skulls we get at the brains. That was the first use of tools that we know of. And then we started developing that on. We're actually using those rocks as pound stones for millions of years, it seems, to get at the brains of these animals, get a very, very nutrient dense energy source. And, and then we started being able to break those in half, and, use the sharp edge to do even more with. And people said, oh, okay, let's go. And that's the thing. And that's what people don't realize. They say, like, well, our hands are naturally adapted to pick fruit, so we must be frutivores. Like, well, but you don't need much brains, to pick a pear,
No, and
and
how is
so,
our digestive tract designed? We don't have four
yeah,
stomachs, we don't have fermentation.
yeah,
We're definitely, if you could probably speak more to the medical, the physiology of the digestive tract, but clearly
mm,
we are designed as humans genetically and
mm,
physiologically to be carnivores. So
100%.
that is somehow being stepped over too in this whole push for eliminating meat from the diet, and saving the planet
Mm,
and all the stuff. But we won't get into that conversation right now.
yeah,
But yeah,
yeah,
well, I know we're getting close on our time. I don't want to take up more of your
that's
time.
okay.
I know you're busy, and I so appreciate you. I'm just doing a little time check here. Joining me today, Dr. Chaffee. Thank you so much. And I think, is there anything that you would want to leave people with, if you could just tell them, the world, whatever it is, that would be like the one tip or the one, I don't know, point that you would want to leave people with? Do you have something that strikes you as what you might want to speak to at this moment?
um yeah, it's, I think that the main thing is that, this is something that can really help people's lives, and this can really help their health and their longevity. And, it's not a little thing. People think there's like, oh, does it make that big of a difference? And you hear some people say, well, even if it improved your health like a little bit, would it be worth it because of all these different sorts of factors? But the fact is that it's not a little difference; it is a massive difference. And, these things really, these toxins in plants really do cause very serious harm. And whether or not they will kill you dead on the spot, most plants and fungi in the world are inedible, meaning that they will kill you very quickly. And, or if you eat enough of it, well, that this is a common theme. Plants and fungi defend themselves by being poisonous, and so even if something doesn't kill you right away, it is going to cause harm, and it will kill you eventually. People are supposed to live 120 years. That's what we're actually genetically designed to live to, is 120 years on average. So meaning that if you just stay out of your own way and don't mess up, you should make it to 120. And yet we're dying in our 60s and 70s on average in a lot of places. That's because of we're eating the wrong things, by and large, other factors as well. But, even making it to 80, 90, or even 100, you're dying decades early. And that's because of these plants. And so, slow poison is still poison. And if you're dying decades early, and you're sick for decades leading up to that, that's something that's significant in people's lives. And these diseases, they don't need to exist because they are not diseases. And if you just take away this exposure, they go away. And so if someone just wants to optimize their health, I would really encourage them to do this, because, just trying it for a month, they'll see firsthand how much better their lives are as a result of it. But if someone's suffering from some sort of chronic condition, then it's so important for them to at least try this, because this can absolutely revolutionize their health and their lives. And I think that, as doctors, what we should really be doing is trying to get people well, as opposed to just managing their disease, because that's not what we're here for. We're not here to blow. A fireman is not there to brush away the smoke. He's there to address the fire and stop the fire. And that's what we've lost sight of in the medical community, is that we're just doing symptom management, and we're managing diseases. We're not treating them. We're not curing them. We're not getting people well and healthy so they can live long, happy, and productive lives. But it's something so simple that anyone can do. Every single person, unless they're extremely impoverished and don't have access. That's another thing. They can do this. They can take charge of their life, and they can take charge of their health, and they can absolutely change so much about their lives. And that's something that I would just wish on everyone to try, at least try it, and improve their life and improve their health, so that they're not reliant on doctors and medicine. Someone said that, people say that, well, it's very restrictive, only eating that way, that's very restrictive. But you don't do drugs, you don't do coke, you don't do meth, you don't shoot heroin. Well, that's very restrictive. Why not? Why are you restricting yourself from that? Well, and people are having a blast doing that. Have you ever seen anyone on drugs? They're having a great time, and you're being restricted. You're restricting yourself from doing that. And why is that? Well, because you recognize this is something that can cause serious harm for your future. And so you're making a conscious decision in your present to help your future. That's what you're doing here as well with food. And, I don't really find it restrictive. I think that diabetes is restrictive. I think that major depression is restrictive. I think that schizophrenia is restrictive. I think that heart disease is restrictive, and autoimmune disorders are restrictive. I think that obesity and chronic pain and arthritis and multiple surgeries where you put your life at risk are restrictive. I think that restricts your life more than anything else on this earth, are your health issues. And if you can take control of your health and completely eliminate these things from being a problem in your life, that's very freeing. That will free you to live your life. Is your life eating interesting meals? That's the only thing that is important to your life? Or do you want to eat food so that you can live your life and have, an expansive, interesting and involved life where you're getting to do all the things that you wanted to do, and traveling and playing sports and just being healthy and being able to play with your grandkids and having the energy to do that, and having your brain work and not becoming senile and developing Alzheimer's or Parkinson's and having neurodegeneration, and your kids, not having your kids, develop with issues like autism, having your kids develop to their genetic potential. Their brains are going to be bigger and smarter. Their bodies are going to be bigger and stronger. They're going to be healthier for the rest of their life. I think that's restrictive, is not being able to live to your genetic potential and live to your full health. And so I would just encourage people to think about that, and think about that, what that truly means, and give it a shot. 1 month out of your life is not much. As Jordan Peterson said when he was going to try this, he said, what's a month? I can hang by my nails from a window for a month. I mean, you think about it in the grand scheme of things throughout your entire life.
Yeah.
If this is something that can absolutely revolutionize your health for the rest of your life, a month is nothing. And so I just hope that people can take this information and hopefully, do something that will help their lives and help make them better.
Great. Thank you so much. That was really inspiring. And I think that people will hear this message and they may try it. And I just really appreciate the quality of life aspect of it, because when I turned 50, I literally had like 5 friends that I knew, very close friends, that had all decided that they needed a hip replacement. Oh, their doctor told them they needed hip replacements because they had joint pain. And when I started getting joint pain after I'd been eating, pretty clean and low carb and keto for years, I was like, what is this just what happens? Like, I'm 50. I now I need my joints replaced. And, I had a lot of clients that were getting knee replacements and this and that, and was like, no, I'm not satisfied with that. Like, I'm not ready to have my joints replaced and, seriously adapt my quality of life to all the things I was doing. And yet I was starting to experience joint pain too. And just was determined that I was going to find some way to fix it. And that's kind of when I discovered the carnivore diet. And so I have to say my joint pain is gone. And I've only been doing carnivore for 2 years, but this 2 years I've felt better than I have in the last 10 or 15 years, even doing really strict keto and stuff like that. So I've always been very aware of sugar intake and that kind of thing, and the benefits of being in ketosis. So, but you can again be in ketosis and even in a fluctuating ketogenic diet and be eating a lot of plants. And I think that's where people have fallen off the rails. And so finding you and Sean Baker and Paul Saladino and Sally Norton. I mean, these are people that everyone should go check out. Okay. Just look them up. And if you want to go deeper down this rabbit hole, there's lots of places to go to find tons more scientific information and studies and things really just showing us what our ancestors always knew, right? So this is not new information. We're just re-illuminating it for y'all. So, so thank you so much for being part of that discussion with me, Dr. Chaffee. I really appreciate it, and I love what you're doing. And I'm going to keep listening to you and listening to your podcast and learning what I can from you. So thank you again for being such a light in the world. Appreciate it so much. Thank you for tuning in to the Ketogenic Diet Show. If you liked this episode, please like and subscribe to my YouTube channel. To find out more information about the ketogenic diet or my upcoming book launch, please visit my website, ketogenicdietcoach.com.